Friends, greetings of 𝘠𝘦𝘵𝐷𝘦𝘥𝘢 Jayanti and Deepavali. Now, after having a controversial disease of diabetes mellitus, now we are going into another controversial disease, that's hypertension, which I consider as a rasavaha srotodrushti. Again, we will not go into that controversy like whether it's true or not. Next slide. That rasavaha concept of that disease itself is a unique feature. Like initially, in the earlier days of physiology, people knew that there was something like a circulating pressure, but it could not be measured, and its importance in the disease was not known till 1896, where the pressure could be measured by a cuff, that sphygmomanometer, it was invented. Till then, the study of blood pressure was only in the experimental animals in the labs, where animal would be sacrificed. You will have to put a tube into the carotid artery and then measure the pressure and so on. So it was never considered as something of a clinical importance. So clinical significance of a blood pressure as a measuring the pressure of the circulation, it came into reality only after 1896. But still, it's not yet still an established one. Actually, the idea of considering this as a disease, it was only after, next slide please, next slide, only after President Roosevelt had an accidental death. It was known that he had hypertension, and very interestingly, he was given a healthy certificate earlier, and after having the certificate in his hand, he had a cerebrovascular accident all of a sudden in a meeting, and then he died. And that became a big issue. An American president dying with a health certificate, and this was in 1906. And from then onwards, the interest about this circulatory pressure and then its value or its importance in the disease was to be considered. Earlier, it was not considered as a disease. It was considered as a physiological parameter, and it was considered as something variable. And the study about the blood pressure, it started only after having this kind of an accident where President Roosevelt died. And then the effort for further study, it started only in 1948 with the Framingham Committee. Even now, that Framingham Committee and Framingham framework of assessing the blood pressure is the most important nodal center throughout the globe, which collects the statistics. After all, hypertension is a disease of statistics. That's what I say. Statistics is an interesting subject. At the same time, it's a very dangerous subject also. So, and boring. That's the other part also. But the problem would be, because it's a disease of the statistics, you will have always some confusion. Confusion in the sense statistics always is misleading. Usual quoted example, which I always quote about the statistics is, suppose a surgical procedure has 1% success rate, and a patient going to a surgeon, surgeon assures the patient that you have a high chance of survival because 99 of my patients earlier have died, and you are the 100th patient. Statistically, he has to survive. But what about the common sense? So common sense and statistics, you will always have an issue. And with the hypertension also, this issue is a very important core issue which we need to consider before we go into the Ayurvedic idea and Ayurvedic practice point of view. Of course, the whole issue is, next slide, about the simple, what's the normal blood pressure? About this issue itself, there is a lot of controversy. Guidelines and the normal values were standardized and then announced throughout globally. And this is the timeline. Now, I think I'm not going into the detail of all that. Almost every 2 or 3 years, the normal blood pressure was revised. Normal blood pressure, which we studied when I was a student in PG, is totally different. And all such people whom we consider as normal pressure, now they are in the severe category 2 hypertensive condition, who need a more energetic treatment. Last of that, now I will not go into the details like what are the changes done in the individual setups like. The latest of that was 2017 AHA guideline. 2017 AHA guideline, next, has categorized the blood pressure under this category. And very interestingly, according to that category, 120/80 is considered as a normal blood pressure. Interestingly, I think every clinician might have experienced it. Very rarely you get a patient above the age of 40 having that 120/80. Most of the times you will have persons, I not use the word patient, people having a blood pressure above that. And particularly in Indian conditions, the number of people having the blood pressure above 120/80 are very common. And if we consider this as a criteria, almost 90% of the people above the age of 40 would be categorized as patients, and they would be requiring some treatment. That's one of the important issue. And then of course, the other categories as such would be the elevated is considered as again up to 130 systolic. Of course, again there is another of the controversy is when we were studying, we were given have studied like the diastolic pressure is more important than the systolic pressure because it produces a cardiac load. But now there is a gradual shift to the attention. Even a single systolic pressure study also is to be considered as a hypertensive. So you will have again lots of confusion issues. But the other categories, of course, when it goes to the higher level, like when it goes to 140 by above 90, then it has to be categorized as a hypertension. That's almost a universal agreed issue. Next, but when AHA, that American Heart Association, declared that 120/80 is the standard normal pressure, all the people over the globe didn't agree. It's not only me who comments on that. There are many people who commented on that. European associations and European doctors, they didn't agree. So there had to be a compromise formula. And what you see is on the slide, they made some compromise like making up to a pressure of 120/80 as something 120/90 as considered as to be normal, and the categorization was slightly different in the European and the American association. Next, still that story is not yet over. The problem would be to record the blood pressure when to be considered as normal. The blood pressure is such a variable factor which can vary significantly throughout the day, and roughly the blood pressure would have a significant fluctuation almost every minute, or maybe at very short duration you will have a fluctuation. So which of the blood pressure to be recorded are considered as pressure of recording? So ambulatory pressure measurement, there was another of the controversy. This came into the picture. Like if you record the blood pressure throughout the day, you will have lots of fluctuation. So hence they came to a standard. The standard is you need to have a minimum 3 recordings in the resting conditions, and the 3 recordings should be done in different setup. Because there is one more. Next, there is one more called as a white coat hypertension. White coat hypertension is because white appearance of the doctors is supposed to be white coat. This is an established term. Yes, white coat hypertension is an established term. Either it could be because of the doctor or because of the environment and so on. Multiple variable factors can produce a significant change in the blood pressure, and hence there was another compromise. Another compromise is you need to have minimum 3 recordings, and then the average of the 3 recordings has to be considered as the normal pressure of that person, and then you will have to assess like whether the patient requires a treatment or not. Still there was lots of controversy. And latest of the compromise formula, now what I have shown in that slide, probably I think the fonts are small, but that's the compromise formula. Compromise formula is if the patient doesn't have any symptom, then even up to a level of 140/90 can be considered as normal. If the patient has a symptom or a allied complication, then it has to be considered as abnormal. The assessment of different guidelines, so on, I will not go into that part. But the latest of that trend is the most popular standard considered in the eastern part of the country, Southeast Asia, is that ADA. ADA consideration is 140/80. Then different associations, they now consider, so wherever you go into the globe, you may have different levels of the blood pressure as normal blood pressure, and so you will have the controversies. Indian doctors, they always follow that American standards. and that 120/80 is considered as the normal, and most of the patients whom you see here would be treated keeping that 120/80 as the target value, and then the patients are treated. Next. The result is, out of what happens, like, now what you see in the graph is the total market value of the antihypertensive drugs. Every time a guideline is revised, our graph goes up, and the prediction is by 2021 it will be $3.5 lakh billion throughout the globe would be the total cost of antihypertensive drugs. So now I'll not go to a direct statement like it's regulated by the market, but the impact of the market is very visibly seen. Whether it's a coincidence or the other way, every new guideline by AHA relates to a recession in the USA. Once there is a recession in the USA, a new guideline comes in, and then, okay, I will not go beyond that, because that becomes somewhat more critical. And moreover, another important issue is, as per the WHO statistics now available, that second half of that, the left half of the slide which you see is the area where the focus has to be. Green color suggesting the Asian area, India and Pakistan, so on, the Southeast Asia portion, is the area where the thrust is now, globally the thrust is to market the antihypertensive drugs, and that's considered, they are considering that there will be a 12.5 compound annual increase in the market for consumption, and that compound CAGR of 12.5 is considered to be very high in the industrial standards, and that's what happens. I'm not making any direct statements about that. The interpretation is left to you. I am not, and reading between the lines is left to you. That's the point. Next slide. Now, that's about one aspect of that controversy. Now, the other aspect, WHO again has given you the statistics of incidence of the hypertension. As per now, this standard is as per 2016 standard. Now, 2017 standard, column would be almost of the same pattern, but height of the column may be slightly raised. The maximum incidence of the hypertension is that AFR is Africa, and then comes to the South Asia. These are the two segments where hypertension is considered to be quite common statistically. Next part. Now, the other part, like why the hypertension needs to be treated. You know, there are many people with high pressure and still they live normally, and it's considered as a silent killer. Most of the times a patient of hypertension would not have any symptom at all. So why the hypertension needs to be treated? There again the statistics comes in. It's all about the statistics. The statistics says that life expectancy after the hypertension gets reduced. I think you can read that. The first line is about a patient with relatively a moderate hypertension, where the life expectancy gets reduced. That last portion, now important is in that horizontal column, that colored area, black colored area, suggests about the possibility of a complication like either a coronary accident or cerebrovascular accident. So your life expectancy may be slightly normal, slightly lesser, whereas the third line suggests about the normal average life expectancy. As Dr. Sripathi has said, century. Now, that's considered as a normal, but if you are having a hypertension, it's expected that it could be lesser. Now, higher the hypertension, if the patient has a very significantly high hypertension, life expectancy would be shortened by almost around 30%. Almost about 30%. That's the fourth line. It suggests about the maximum impact of the hypertension. Fifth and sixth line again about the relatively high normal blood pressure. This is again based upon the statistics collected across. References are there in the baseline. Next part. Now, the other important issue is hypertension is considered to be a cause of the cardiovascular mortality, sudden death occurring due to incidence of cardiovascular pathology. Now, that possibility of cardiovascular pathology, having a cardiovascular pathology, still exists even if you consider the pressure as normal, 120/80. Now, this is about our latest guideline. that first line is the possibility of, statistical possibility of having a cardiovascular accident, a coronary accident anytime as per the normal, whereas the last line is about the stage 4, that's the highest of that blood pressure. Now, I will not bother about that part, is fine. If you compare the height of the columns of the first, second, third, the difference is virtually very minimal. And that difference is not statistically significant, though there is a difference. Now you can see, you can appreciate by the column. These columns are not drawn by me. I have collected from authentic sources. The sources are over there. Now this is about the total picture about why the hypertension needs to be considered. Hypertension is treated with an idea of preventing those complications like cerebrovascular accident. And in those categories which we call as the low and moderate hypertension conditions, that risk level is relatively very small, and that small difference, whether it needs all that attention or not. High category, fine, that very high pressure, terminal, third stage hypertension, the difference is quite significant, definitely yes, it needs to be prevented. Whereas if the other causes, whether we are really able to prevent that or not, that's one of the issues.